Yes, we are the home stretch.
Yeah.
And we're going to look at something that every one of us is concerned about. Health. We started with the sanitation issue, right? So we're going to look at the health sector, what it's been like. In 2010, Nigeria was rated 10th for age standardized years lived with disability and 13th for health adjusted life expectancy among 15 comparable countries. Preventable disease accounts for, they say, most of Nigeria's disease burden, and poverty is a major cause of this problem. So all of that. Don't ask me. I have some health experts here. Don't look at her either. She's not even there. It's okay. But compounding the problems for healthcare services in Nigeria include the limited capacity for policy formulation, implementation, monitoring, and evaluation at all levels of healthcare delivery, and the differences in disease patterns in the 6 geopolitical zones of the country.
The bottom line here.
The bottom line is
how can
there be something that needs to be looked at in the health sector.
Yeah.
Something needs to be adjusted.
How can we move it forward?
Right.
Give it the lifeline.
This lady.
Okay, we have the professors in-house.
Rotimi Jaisimi, Associate Medical Director for Patient Safety and Consultant Obstetrician and Gynecologist. Thank you.
Good morning. Thanks for having me on the program.
Dr. Edamison Temi, I hope I got that well.
Yeah.
Former Chairman, Nigerian Medical Association, Lagos Branch. Thank you for coming.
Yeah.
Thank you very much. Good morning.
Good morning. Let me begin with you. You're the former chairman of the Nigerian Medical Association.
Okay.
Well, you might say it's just Lagos. But talk to us, what are the major challenges facing the country in the health sector?
Well, the major challenges is actually, the organization of the health system in Nigeria. From independence up till now, maybe until 2014, there was no enabling laws describing what to do and what not to do in the health sector. We just pick things because it's been done or handed over to us, and we are doing them. However, in December 2014, we had the first law, the National Health Act, signed into law. And up until now, we have not implemented it. For example, you see in this country, the local governments try to do what the secondary level heads should do, and the federal government doing everything. And at the end of the day, nobody is responsible for any aspect of the health system in Nigeria. That has been a major issue in the country.
Okay,
Professor Jayasimi, you've been from outside the country, you've been practicing, and looking from that angle, what do you see in Nigeria's health sector?
I think, just like my learned colleague has said, there's disjointment between the 3 tiers of health sectors. Most of the disease burdens in Nigeria can be managed at primary care level, and we haven't paid very much attention to that until recently. Why is that? Perhaps it's the infrastructure, staffing level at primary care level. People tend to go to teaching hospitals for malaria, diarrhea, and very simple conditions that can be managed at primary care. Secondary care, general hospitals, a step ahead of primary care. But you have to have a flow process from primary care to secondary and tertiary, and not just anybody pitching up at any of the centers. But to achieve success, 70%, like I said, of most of the problems we have can be managed at primary care level. And until we address that system, the building blocks are there, but we need a stronger and tighter framework to deliver a safe service.
Yeah, and he just mentioned it just very late last year. The health bill was signed into law, but of course implementation, we are not even talking about it right now.
Yes.
And you find that yes, Nigeria has moved forward a bit in terms of some of the statistics. Before we say 555 women would die from at childbirth. But it's reduced, but it's still very high.
Still very high
compared to the
other
figures.
Nations, yeah.
Yes, we have clusters or pockets of excellence here and there in the healthcare in Nigeria. How really can we put Nigeria's health sector where it should belong?
Well, the first thing is to have a framework of what we're going to do. This National Health Act has provided a framework, and we need to implement them. The primary health care level is very important if we are going to move forward. All those figures we see, without the primary health care being strengthened, it will not improve substantially. We'll just be making an incremental improvement. It won't be substantial. But when you strengthen the primary care system, then you will see Nigeria moving very far in improving the healthcare system in Nigeria. Unfortunately, the type of government that should implement that is the weakest in this country. Now, when we give them things to do and there's no funding, proper recruitment of staff to manage that sector, we will have issues. And that one of the issues we still have is that the local government system that is supposed to run the primary care system is still heavily tied to the state government. In fact, they are hamstrung. If you see a local government that is trying to do something that the state doesn't like now, the state just remove the person, and that is the end of that local government. So, to some extent, we need to strengthen local governments and allow it to function, and define clearly what should be done at every sector of the economy. We have health workers. For example, the federal government, in trying to reduce the maternal mortality, has to hire midwives for local governments to be functioning. You can imagine somebody determining what is going to be done in my local government far down south, or a local government in Borno State. But the more the government moves closer to the people, the more effective that they will be. Then the secondary level can now take issues up. Like Prof said, the referral system in Nigeria is very weak and is disjointed. Even when you handle people at the secondary or tertiary level, once you finish managing them, you are supposed to refer that person back to his primary, level management, and they just go to the secondary or tertiary level when occasion demands. That is not even in the system yet, and we are hoping that implementation of the health